topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Welcome to my radio and TV show, Debi Changes Lives. I'm Debi, your certified holistic health coach. I revitalize people's lives by helping them identify the root causes of their health and mindset issues and create a custom, natural, holistic strategy to address them in the areas of mind, body, and soul. As a health coach, I'm not allowed to say that I heal, treat, cure, prevent, or diagnose any diseases. I can certainly make your body more efficient by reducing symptoms. You'll feel better, be more productive, and enjoy life more. And as you can see here, I released 70 pounds, had a health and mindset transformation, and kept fit and trim for over a decade. And honestly, it's been over 12 years. I even became a half marathon runner at the age of 51 when I never ran from childhood to adulthood due to foot pain. And I've done 9 half marathons so far. Mindset is the key to lasting change. As a certified holistic health coach, I do revitalize people's lives in many different areas of health and mindset. I guide them to clean, toxic-free foods and high-quality essential nutrients. My coaching's for optimizing health, whatever that may be, releasing weight efficiently when needed, and enhancing your mindset. With my clients, I help them recognize that their thoughts, feelings, and emotions drive their actions and results, sometimes good, sometimes bad. That's why it's crucial to have a positive mindset in life. It's also imperative to release those low vibrational emotions like fear, frustration, and doubt, because all that's going to do is slow you down and get you stuck physically, mentally, emotionally, and spiritually. Like a hot air balloon that has ballasts, I help my clients release those emotional ballasts and baggage so they can uplift to a better, happier, healthier life. In turn, they are releasing their stress. They're getting healthier and they're reshaping their core beliefs. You'll see and feel the differences with my coaching programs. Ask me about them. Set up a complimentary consultation at Debi Changes Lives. That's DebiChangesLives, as in Victory, ES.com/Linktree, LINKTREE, or use that QR code, and I'll guide you to that better, happier, healthier life with custom, natural, holistic solutions unique to you in the areas of mind, body, and soul. And in my past, I am no stranger to chronic pain, and I'm really happy I found solutions. Today, I have Yvonne Rea, who's the owner of For a Better You Too, educator and a microcurrent pain specialist. Since 2012, Yvonne has been making the unknown known with pain relief, where 85% of her clients are noticing a significant difference within minutes versus months. Drawing from 15 years of military service and forensic sciences, she specializes in pain relief and tissue regeneration. Her extensive experience covers functional medicine, epigenetics, bioelectrophysiology, and holistic nutrition. Currently, she serves as the nutritional director, Microcurrent Therapist, and the lead educator for interns at Racing Pain Center and the Theta Wellness Brain Centers in Sacramento, California. As a dedicated researcher, in 2022, Yvonne initiated a clinical trial using Hachette protocols to study lung health. Her work demonstrated how microcurrent can increase oxygen levels in a single session, potentially circumventing emergency room visits caused by chronic inflammation. Yvonne's mission is to increase awareness of how microcurrent therapy, coupled with holistic nutrition, can radically accelerate recovery. To further her goal, she co-founded the Healthy Ways Practitioner Network that is going across Northern California. So today we'll be discussing Beyond the Pill for Spinal, Sports, and Neuro Injuries. So let's welcome back Yvonne Rea, the owner of For a Better You Too, educator and microcurrent pain specialist. Back to my show. And Yvonne,
Hello.
welcome back. Hi.
Good to see you again.
It's good to see you again too, and we have a lot to cover. So let's get started. Now, with my clients, I always tell them that they need the raw materials to rebuild the 90 essential nutrients. And why is it that microcurrent can repair the signal and can replace muscle tissue without nutrients? It's really important that both of them are there, right?
Absolutely. Well, so what the microcurrent does is it removes the burden being, let's just say, inflammation, low circulation, low voltage of the tissue. We are both electrical and chemical. And without that electrical, the chemical actually struggles. So I want you to maybe look at it like this. The battery would be the minerals, calcium, potassium, sodium. The wiring, that insulation that goes around and provides the electrical spark, that has to be covered. And in the body, that would be covered with, that's the myelin sheath that covers around nerves. Myelin is made of cholesterol and good fats. So for that to travel without leaking or misfiring, you have to have the nutrients. And then let's just say the transmission, that would be salt, sodium chloride. Mandatory, absolutely mandatory for the biochemical system to work for the nerve transmission. Without it, you don't have a signal firing. Does that make sense?
Yeah, that makes a lot of sense. So they both marry together to be more efficient.
The marriage, yes, of biology and technology. Absolutely. Absolutely.
Exactly. Now, I've been using microcurrent with someone in my family, and it's really interesting that different frequencies are for different issues. So could you explain how tissues have radio frequency and how they actually tune into a liver versus a ligament, especially when someone has a sports injury?
Certainly. So much like when we take in nutrition, there is some very specific nutrients that will target different tissues of the body. We have 4 basic tissues of the body. That's nerve tissue, epithelial, muscle tissue, and connective tissue. So to answer your question, with microcurrent, and specifically the microcurrent instrumentation that we use from Avasia, it is tissue specific. So I can go in and hone in not just on muscle or tendon work, but we can get even further down, nerves, bone. But remember I said earlier about the nutrients? The raw materials that created that nutrient outside of stem cells are the nutrients that we get from our plants, our animals. And think about this, the minerals come from the soil, the vitamins come from the sun. Together, they create compounds. And science knows very clearly this isn't, my recipe. I'm just utilizing the recipe, bringing together microcurrent and nutrition to not only repair, but we also know that we can, in fact, rebuild. And a lot of this research is happening in the beauty industry. You've probably heard of anti-aging, anti-reversal, right? It's a $1 trillion industry. And so there's a lot of focus on using those words because they have deemed that we could take tissue back when we get enough of it in. Remember, size matters. We get enough of it in that you not only repair the tissue where something got sewn up a little bit, but where it is now rebuilt. It's thicker, it's stronger. It has the extension, like let's just say if somebody has, you're talking ligaments and tendons, Dupuytren's contracture, or somebody that is constantly having their shoulder get misaligned, misplaced, and they have to, kind of shove it back in. Or maybe somebody that's rolling their ankles where they can grab their knee and move it. All of those are nutrient deficiencies.
Yes.
And they know exactly what it is. So because it's tissue specific.
Yeah. And I noticed when I was using this, your device, the microcurrent device, that there's different frequencies that you have to use for certain parts of the body. Do you want to explain how that works just a little bit?
Sure, just kind of like a radio station, right? If you want to listen to pop, to country, to Spanish music, Latin, each of those have their own radio station, and those are radio frequencies. Well, between all the years of NASA and science, they have honed in, including Tesla. Everything is oscillating. Nothing is standing still. Well, once they figured out what that oscillation was for an organ or for a tissue, they set a number to it. And it just means how many times it's rotating per second. And so an organ within the microcurrent, we might, and it will depend upon the hertz and the amperage that one is using with their devices. So I want to be very clear. This isn't light. This isn't sound. All right. Would resonate wonderfully within the 90 hertz range. That's its sweet spot. Oh, I just love to be here. But if it's resonating, let's just say at 300, that tells us very clearly that it is angst, agitated, aggravated, could be inflamed, impinged. I can't put a condition on it. Doesn't matter. We just want to bring it back into its norm. Or let's just say it's way down low, like in the 20, 25 or under. It's atrophying. It's underperforming, underworking. It's tired, sleepy. We want to impart some voltage there, stimulate it. I say, give it a little love and bring it back up to where that sweet spot is for the organ.
And this individual is actually feeling the effects. He's feeling better. He's doing better. And I'm really happy that we got a unit from you guys.
Fantastic.
We've used it for, things with his, with his ligaments, as well as, his stomach too. So all of that is just very helpful to know that there's a variety of things, including skin, making yourself look a lot better as well with this product. Now, a lot of people just don't understand the difference between the TENS unit. And that's why the whisper strategy of the microcurrent is so more effective than that scream of that drugstore device. Don't you agree?
Well, and not even just a drugstore device, because I have had people kind of say, well, I got mine from my doctor, whatever. But one of the big differences, well, there's several differences. I'll tell you, one will be the voltage. A TENS unit cannot go very deep in the body. It also, like you said, it's screaming because it's at a higher intensity. And the other thing is it's on a different waveform. Our body is on the sinus wave, also known as a sinusoidal, or even more perfectly, or that sweet spot would be, the biphasic sinusoidal. And we would see that in that blip when we're looking at the heart on instrumentation, right? And so the TENS unit is higher, so it's screaming. It's on a different waveform, so it's speaking a different language. It's also, the voltage is low, and so it can't get enough voltage to go much further than the first couple layers of the skin. And so, this is a couple of the big reasons that microcurrent is so different. Now, everybody started, we were introduced first to a TENS unit, and many people can have pain relief, but the TENS unit will do one of two things. It is not a regenerative tool, but if it can block the pain signal, you feel better. Is there really any real resolution there? No. Or it's a muscle stimulator, much like some doctors will use in their practice. Maybe a physical therapist, chiropractor, they'll use oftentimes muscle stimulators. So while those will kind of wake things up, again, there's no regenerative, no real resolve of the tissue.
And tell you the truth, sometimes I am very sensitive to something like that. It makes me jump, when a TENS unit or something that's similar like that.
Yeah.
And, I feel like it's not really doing me much good if all the time I'm jerked into something. So that's something to think about, where this doesn't seem to be doing that.
Well, yeah, we're not doing that. So I always want to educate so people are very clear. Here's what your tool or a TENS tool can do, and they can bring about some relief. And then, of course, without the nutrients, or if they add the nutrients, they're just going to get even greater results. Same thing with the microcurrent. The microcurrent, when we add nutrients, we get better results. But remember, I said we're going to go in, we're actually going to help increase the voltage of the tissue that is out of balance.
Yeah, and it doesn't jerk. It doesn't jerk you, is what I'm trying to
Right.
say.
Right. So we're going to bring it back. We're going to help it bring it back to better health. And that might be, like you mentioned, settings. I might, use a setting that first addresses inflammation, because inflammation is the precursor to pain. And we can go in there and start help removing that swelling and that inflammation, and then increase the circulation. So the more that you put in this pie hole that really brings wellness, like I truly believe in supplementation, just the faster rebuild that you're going to have.
Yeah, very true. Very true. And since we're talking about electric signals, is there true electric signals in the fascia, that gristle that covers the muscle, that can travel almost at speed light? And how does this help us bypass nerve damage?
Okay, so you got two questions there. And yes, absolutely. Fascia is that thin layer that a lot of times we might see in an elderly person. As their tissue thins, we begin to see kind of like a spider webbing, right? That is the fascia of the tissue. And I would encourage everybody to go look on YouTube. And there's a video, absolutely wonderful. A surgeon did this. He took a microscope, and it's called strolling along the fascia. It really is quite amazing to see. But yes, that is where the electrical travels, and electrical is almost instantaneous in the body. And so what was the question? Did I answer the question?
Yeah, you answered part of the question. But how does that help us bypass damaged nerves?
Oh, okay. Well, so there's just so you know, there's a couple different types of nerves. There's A, B, and C fiber nerves, right? So when you have those, and let me just clarify, the A and B A, B, and C, it's either myelinated or unmyelinated. And with the myelination, remember I said earlier, especially for a nerve, it acts as that surrounding around the wiring so that the electrical spark can actually move about in the body.
Like a conduit type of thing?
Yes, it's a protective layer. And I'll just say this. If we don't have it, if we don't have that myelin sheath around the nerves that are supposed to be myelinated, and that would also be like the ones in the brain, what you get is almost like there's a nerve, but the sheath around it has holes. So imagine a Swiss cheese is wrapped around it. The electrical comes through and it can jump off at any point.
Oh, wow.
Yeah. And so A, B, and C, again, they're classified either by their diameter, the myelination, the conductive speed, because the thicker ones, the myelinated ones, those actually travel faster. And those are for your sensory and your motor skills.
Okay. Well, that's really interesting. I haven't heard that one before, but I've learned something.
I get kind of geeky. Let me know if it gets to be too much.
No, I completely, understood it. Now, I've heard that, you have a metaphor, hospital in your hand. How can this device be as simple as using a toothbrush at home for traumatic brain injury and anxiety?
Oh, gosh. Okay, so I'm just going to show you a piece, and I'm going to grab a couple pieces. So when there is traumatic brain injury, which can also affect the, as the spinal injury, first of all, we would use a hairbrush attached to our devices. So this device acts as a generator, and I can have a microcurrent. I can have light, a PEMF, scalar. So it becomes a multi-tool is really. And when we're talking about the brain, there are a couple different ways that we can non-invasively access the brain. And that would be considered, off label. But what we do is instead of going in and planting an electrical stimulation in the brain like they do for Parkinson's, for other traumatic brain injuries, we can access those nerves, again, non-invasively. And we have had traumatic brain injury. I have one. If you want, I can share the story. But yes, we have multiple ways to use it, especially, think about this. Stroke actually is a traumatic brain injury. It is an electrical event that leaves scarring and paralysis to that damaged brain tissue. And there are ways to go in there and start to get things rolling again.
Why don't you just share a very short story?
Well, when we're talking about traumatic brain injury, I'll just tell you a quick story about Melissa. She was hit by a garbage truck when she was 14.
Oh my God.
And in a coma for about 4 months. When she did wake up and go through therapy, there were still quite a few challenges with her. She drooled constantly and daily. She was eventually able to walk, but she fell anywhere from 5 to 6 times a day. And when she fell, the connection between the spinal and her brain, she didn't bring her arms out to stop, to catch when she fell. So she was constantly re-injuring by re-hitting her head again. And that went on for 41 years. I can't quite remember the time frame, but maybe about 3 or 4 weeks into working together, the first thing that she told me was that her drooling had stopped, drooling after 41 years. We had worked together for probably a good, I'd say it was close to 6 months. And she came in and she was so excited because after we had put the device on her and we let it run for some time, there's some very clear protocols that we did. Her progress was remarkable, and she stopped falling 5 to 6 times a day to not falling anymore.
That's wonderful.
And we did engage the legs also. It wasn't, so we had several areas that we needed to work with. And then, of course, the nutrition was a huge part of that. The electrical got things running again, the sparks flying, but it was the nutrition that did the rebuild of those tissues.
That's wonderful to hear.
It is. It is super exciting.
It's super exciting. Now, I know we've been talking a lot about the myelin sheath. And, when you see somebody with transverse myelitis, and they're told they're going to be in a wheelchair forever, how does this rebuild approach often is a hope where the conventional medicine just often stops?
Well, the beautiful thing about these devices is they are, FDA cleared for pain. And we can go in and start to address the inflammation. The TM is a rare condition that they state, is caused by inflammation to the spine. And it begins to destroy the myelin sheath, which, remember, we talked about earlier, will disrupt the nerve signals. And it can cause, some a rapid onset. And so we go in and we begin treatment. Now, typical treatment would be steroids and plasma exchange. We go in and we just begin treating, flooding the spinal column with the circulatory settings, and then being very specific with the nutrition like, remember I said earlier, size matters, to increase the good fats. That would be the cholesterol and the good fats. So we use some very specific nutrients that we have found where other things, we got a slower result. We may have gotten the result. Remember, I said size matters, dosage matters. So we're talking about therapeutic or clinical doses, because it's not enough to just have your glass of, whether it's a protein shake or nutrients. I need enough. Here's enough to survive the day. 2 would be enough for me to maintain my current status. 3 might do the repair, but you need 4 or more. You need therapeutic doses for that actual rebuild. I don't just want to shore up that little tear. I want to go in and let's get this rebuilt. So there.
That's fantastic. So obviously you've seen some miracles that become normal in your practice, right? It's all about this technology of the microcurrent that makes walking again after a major injury feel like a repeatable task rather than just luck. Is there anything else you want to share? I mean, that's pretty much what the question was.
Well, sometimes we have talked in our clinic about, like you said, we have seen so many miracles. They feel like miracles that they become every day. When you begin to put together these two technologies, they know exactly what the tissue frequencies are. They know exactly what tissues and what nutrients are required for these tissues. And let me just be really clear. It's going to include, there's nearly 100 essential nutrients for the body. You got to get them all in, but you may have some that have a higher dose specific to that tissue issue. Like hard tissue would be anything that would be connective tissue and muscle. So that's bone, bone marrow, bone matrix. A lot of times people just think hard tissue is one. We're also looking at anybody that has an immune system issue where the bone is not making enough of the red blood cells, white blood cells, or platelets. So it's hard tissue is also involved in the making of those at the epiphysis of the bone.
Mm-hmm.
So an immune system issue can fall under a hard tissue issue. And it seems like, well, wait a minute, I have a blood issue. Well, technically you have a connective tissue issue because, well, anyway, without getting too geeky.
No, it's important to have bone marrow to create these things. And, and that's what you're getting at. So
yes. Thank you.
Okay.
And I mean, I know you know this for your clients, and you are doing the best, with what you have to put. But every once in a while, and I was one of them, the nutrition got me this far. It got me way further than I was ever anticipating and was ever told I could be at. As a survivor from Camp Lejeune, I drank the water. And my health was failing fast. And I was given mostly either therapies or pills to address the health challenges that I was having. And it wasn't until I started looking into nutrition and alternative care that integrative or regenerative medicines, that I actually saw the beginning of my even better change.
Oh, that's wonderful. That's wonderful. Now, I just found out today you have a electric docuseries, Healing Beyond the Pill. Do you want to explain that a little bit?
Absolutely. So what I'm looking to do is take all of these modalities that we've been able to use, these tools, and ultimately dedicate and gather in subjects, objective data that shows how the electrical system of our body is married to the chemical system. And if you think about it, everything that we're taught is really just driven along the electrical system, whether it's a pill or a surgery. I want to talk about combining these would be advanced microcurrent therapies with advanced nutritional support so that we can, change the tissue and rebuild it. And it's going to be broken up into like spine injuries or traumatic brain injuries or eyes. We have an incredible eye health and have had several that are now seeing, like my eye health. I am still wearing glasses, but it is better. My prescription was once a 4.0. And then it dropped to a 2.50. Today it's a 1.75. I've kind of stalled out on myself, to be honest with you. I have not kept up. I'm, as a practitioner, I'm constantly either in the clinics teaching interns or doing research. And so that has not left me with a whole lot of, time for myself. But, if I never not wear glasses, that's okay too, because I have others in our community that are no longer wearing glasses. Or I have one gal, this is very interesting. She started wearing glasses at 14. And today she's currently only wearing one contact because the other eye is perfect. This one needs a little bit more love. And then I think maybe she's going to be even without that contact.
Well, that's fantastic. We have about a minute or so before you we're going to ask for your offer. Is there anything else you want to add?
Well, you know, I was thinking I might talk to you about one of the spinal injuries, whether that was the myelitis or we had one with a contusion.
Okay, talk about the contusion because you talked about myelitis.
Yeah. So with that one, we had a elderly gentleman fall off. This is one of Dr. Dombrowski's patients and friends from the Pentagon. And he fell off a ladder, hitting the fence when he fell. Ultimately, had a contusion right there on C5, and lost use of his arms. Ultimately, they applied the microcurrent in a couple different ways. One thing we do first is come along the spine. And then we come in and use conductive pads. Many of you might recognize some of these types of things, and we place them along the back. Again, running some very specific settings to decrease inflammation, increase circulation, and then as needed, really get down into whether it's bone or nerve or and just try to bring that voltage back up so that that tissue can get back to performing like it was designed to do.
Well, that's wonderful. That's really nice to hear. So, okay. So why don't we, what are you offering my audience today and get to your offer?
Well, like you mentioned, I think the biggest thing that I have interest in is getting this electric docu-series up and running and online and having enough case studies that in different areas with different tissues and a couple things that I'm looking for are gut health challenges that maybe there's loss of motility, gastroparesis, things that are just not proving to showing any improvement. And I would love for, if you want to go onto my website and reach out, leave your email, tell me what it is that you have, and please mention specifically the docu-series. And it is called the Microcurrent Revolution docu-series. And we're going to be talking about healing beyond the pill.
That's wonderful. And you'll get a free ebook, because she's offered that on the slide. And
yes, thank you.
She has a private community that's in Northern California for microcurrent that we've mentioned in my intro. So any of these links, you can reach out to her and find out what is and how does microcurrent work with biofeedback work. So thank you, Yvonne, for being.
Yeah, and I'm here in the Sacramento area, so if you're close or going to be flying in this way, I'm always happy to try to make accommodations.
That's wonderful. So thank you for being my guest again. I will have you back. Will you stick around for closing remarks?
Absolutely.
Okay. Now, everybody remember, I do revitalize people's lives in many different areas of health and mindset. I start off with the gut and mindset, but I do help you with blood sugar, hormones, brain and heart, bone and joint, as well as immunity. And I help people that are anxious up to athletes because I am guiding you to toxic-free foods and high-quality essential nutrient products that will reduce symptoms. You'll feel better, possibly release additional weight like I did. I release an additional 20 pounds that made it 70, and it's going to uplift your mood. With my mindset coaching, I help you release that stress, emotions, emotional entanglements, and I'm there as you're reshaping your core beliefs, and your mindset will be enhanced. With my health optimization and weight release, your body is going to be more efficient. So that's the mind-body solution that makes your heart and soul sing. Ask me about my program. Set up a complimentary consultation at Debi Changes Lives. That's DebiChangesLives as in Victory ES.com/Linktree, LINKTREE, or use that QR code. Then when you do this, you get to know me, I get to know you, and I'll guide you to your optimal health. And it starts with 1 or 2 health assessments. The first one is the health evaluation, where you're going to rate your systems the last 30 days in 4 categories of health. Some questions that are multiple categories, answer them all. And you'll get a baseline score. Don't be scared of it because it's going to improve. I'll review it with you. And I'm going to create that custom natural holistic strategy for you that's going to improve your score on a monthly basis. I also have 2 different body scans. And with that, I prefer to do the Vizera link because I can send it remotely and internationally. I have sent it to Australia as well as South Africa. Vizera link is a transdermal optical imaging app that I send a link to your phone. You would scan your face for 30 seconds. It's going directly into your skin. It's not recognizing anything in your face, only looking for blood flow, for components of energetic, functional, and emotional in different body systems and lifestyles. And what I love about it is that emotional component, because it's using Chinese traditional medicine where you have an emotion that can affect organs, like anger can affect the liver. But this is not diagnosing you. It's creating a wellness report of biomarkers out of range and products and services that bring it back into range. And I will review it with you. It's quite intensive. That's why it costs $75. And when you move forward with a program or a product, I will give you a $25 credit toward one of them. The Vizera link is that transdermal optical imaging app, also known as TOI. And you can look up those terms on pubmed.gov. That's pubmed.gov for more information and about its accuracy. And also, people are really amazed what their body tells them through the scan, and you be too. Curious? Get that scan done and see what it's all about, or ask me questions at my consultation site. Now, on that site these are some of my programs. Take Your Body Back is a 12-week weight release mindset coaching program where you can utilize a new version of you to drive you to success. All coaching is done on Zoom. The first one's always private to you. Because I am a certified HIPAA health practitioner, all health evaluations are private to the individual, and I go over that first. I give you a choice between 3 different programs, and one's a natural approach to the GLP-1 with no side effects. Then I give you directions on the program that you choose. Then I give you instructions how to create that new version of you that's going to drive you with emotion and passion to achieve your health and weight transformational goals throughout your journey. Now, the rest of the coaching is the same, whether it's private or group. We'll be celebrating our wins. I'll be showing you how to use your boards, and I'll guide you over gaps with health and mindset tips. You will become a new you. This program has changed quite a bit, so you have to ask me questions about it on the consultation side. If you're a do-it-yourselfer, why fast is for you. It's an intermittent fasting program that gets your cells and body humming, in turn boosts your metabolism with rich, dense nutrition and high-quality essential nutrients, and a program of exercises and recipes. Intermittent fasting boosts your metabolism, but it also clears out the trash too. If you have any questions about this program, you can go to my consultation and ask me questions. And if you feel like you need a 2 or 4 week program, you can pay for that to get you going. And it's up to you if you want to continue with more coaching. And then for mindset enhancement as well, health optimization, you can start off with these smaller programs. Those are really longer term journeys. But at least these smaller programs gives me an opportunity to create a custom program for you that might be shorter and more economical for you. And I'm still offering Debi's Coaching Chats, which is a complimentary coaching service in an intimate group setting. It's 30 minutes long. It's not recorded. And for the video audience, it's based on a topic survey pick. So these are the topics for the video audience. If the radio audience wants to have the topics, you can email me. These meetings are on Tuesdays at 4 p.m. Pacific, 7 p.m. Eastern. And you would go to Debi Changes Lives, that's DebiChangesLives and VictoryES.com/chats, CHTS, or use this QR code to register. And you'll learn what my coaching is all about. Finally, learn more about alternative health services, programs. You can go to the next slide, products, offers, as well as articles, blogs, upcoming shows, promos, and events. By subscribing to my newsletter, which is again at debichangeslives.com, this time /radio TV show, all in lowercase. And you can also use that QR code and you'll get a gift, a 30-day health and mindset daily action journal where you can record your gratitude, thoughts, feelings, emotions, as well as food, water, supplements, and exercise you do on a daily basis. You can even track your measurements. Then you want to review it on a weekly, daily, monthly basis to see your wins and celebrate them. Find your gaps to work on. If you need help bridging that gap, contact me for coaching. This journal is a great health and mindset awareness tool. I am certain that you found this show educational, eye-opening, and informative, and you enjoyed it. Reach out to me for my services, products, programs, and offers. And reach out to Yvonne about her offer. Get on that, educational electric docuseries, or even use their services. And do we have time to get back to Yvonne for a closing remark? There, do you have anything else to say? We have about, 3 minutes or so.
I'm just checking in to see if any of your audience had any questions, and or,
Well, they can always put questions on the comments on Debi Changes Lives YouTube channel, and I'll definitely redirect it to you. So.
Fantastic. Very good.
So do you have anything else you want to close off to say?
Like I said, I'm in Sacramento, and if, you got some questions about microcurrent and turning some things around, give me a call.
Okay.
And reach me out through my my website, forbetteryou2.com.
Exactly. Now, I want to say that you can rent these devices, and she'll give you fantastic instructions. And it has been very beneficial for my family member that we've had it for this many months. But, we've been using it for different things because different things come up as the healing process happens, right?
Yeah.
And this individual wasn't able to walk, and now he's walking, and he's getting right into physical therapy just this week. So we'll see what happens with physical therapy. But my whole point is we helped him with that. We helped him with stomach issues as well. And we have to use a little bit more of that with the stomach in the future. But my whole point is that this is a device that is so beneficial that you really are going to love it.
And I'll tell you, a lot of times when I got it, when people get it, they think, well, what am I going to do with it when I'm done with pain? And by that point, they begin to recognize, stuff comes up in life. And we call this, my device specifically, because it is the advanced device, but we call this a hospital in our hand.
Yeah.
And then the home device, we call a wellness center in our hand, because there are so many things that you can work on, muscular, tendon work, ligament, back pain, inflammation, arthritis, which is inflammation, right? Plantar, anything that has the word itis behind it.
Because it's inflammation. Yes.
Yep. And there's a book that comes with it that has nearly 100 protocols. So that'll tell you a little bit about the scope that it can help with. And most practitioners aren't even aware of this. They really are not. They know of the old 90s microcurrent. This is a microcurrent with a biofeedback. You can see instantaneously through the lights and the display how the tissue is responding to your treatments in the moment. And it will also, so that you don't get accustomed to it, it's also adjusting as that tissue changes. The microcurrent itself has a split chip or dual chip, depending upon, but you get a second computer chip in there that's doing other information so that you get a better response. Wow. Way
Yeah,
cool.
that's wow. And don't forget, it can help you with anti-age your skin. So thank you for
Absolutely. Most people know microcurrent for that. Those are not this microcurrent, but this microcurrent, it can offer that as well.
Well, thank you for being on my show.
You
And
bet.
I'll be back and continue to enjoy my radio and TV show, Debbie Changes Lives, on Thursdays at 3 p.m. Pacific, 6 p.m. Eastern, where your holistic journey begins.